The Democrats in Congress are working to pass President Biden's new spending bill in July. Chuck Schumer and Nancy Pelosi are pushing to pass a new round of inflation relief checks, and some Republicans insist that relief checks should be approved. Democrats are currently racing to finalize a scaled-back economic spending package that salvages several portions of the $2 trillion budget reconciliation plan that failed to pass last year in December. But many experts insist that the effort largely rests with Joe Manchin. Chuck Schumer has also said that Democrats have about 3 months to reach some sort of compromise. Otherwise, everybody, they may lose the ability to pass the bill under a special legislative tactic that allows them to bypass a GOP filibuster in the Senate. And I know many of you are wondering what will be included in the updated version of the bill. Well, the bill will be narrower with the Build Back Better plan, passed by House Democrats last year. It's likely to center around measures to lower prescription prices and combat climate change, while also including other energy security programs sought by Manchin. It's also likely to include some tax increases that will be used to pay for new programs and reduce the deficit. Lawmakers also insist that for the new bill, including a new relief payment for Americans. Negotiations are also on health insurance. If you get your health insurance through the government health insurance marketplace, you may want to brace for higher premiums next year. Unless Congress takes action, everybody, enhanced premium subsidies that have been in place for 2 years will disappear after this year, and this will cause definitely some disruptions. Cynthia Cox, a vice president at the Kaiser Family Foundation and director of its Affordable Care Act program, told CNBC News that the default is that the expanded subsidies will expire at the end of the year. On average, premiums will go up more than 50%, but for some, it will be a lot more. Most enrollees, which include the self-employed and workers with no job health insurance, receive subsidies, which reduce what they pay in premiums. Some people also qualify for help with cost sharing, such as deductibles and copays on certain plans, depending on their income. Before the temporary changes to the calculation for subsidy eligibility, the aid was generally only available to households with income from 100% to 400% of the federal poverty level. The American Rescue Plan, which was signed into law in mid-March, removed the income cap and the amount that anyone pays for premiums during the time, it limited to 8.5% of their income as calculated by the exchange. An economist, Jason Furman, who led the Council of Economic Advisors under President Obama, told CNBC News that whatever Democrats do or don't do with this bill will affect the Federal Reserve as it looks to rein in inflation. And for the last 6 months of the year, parents across the country received monthly checks. The expanded child tax credit lasted up to December 2021. It allowed for parents to receive up to $300 a month per kid, and the program helped keep millions of children fed and out of poverty, touching 35 million families. It lapsed in December after Republicans and Manchin prevented Congress from making the checks permanent.
Thank you, Mr. President. I could have no more done that when I was 12 years old than fly. I used to be a stutterer. I was scared to death. I would stand up and talk like that. And I can't tell you how proud I am of you. And your brother is equally as impressive as you are. He's standing there. He's sitting there 2 seats over. Shannon and Joshua, by the way, happy birthday, man. He's going to be 13 years old, teenager, in a couple days. I want you to know that lowering the cost of prescription drugs is one of the reasons why I'm here with Abigail, your congresswoman. And that's what I want to talk about with you today. Lowering the cost of health care overall as well. Lowering the cost of prescription drugs is important, and giving families like yours just a little bit more breathing room makes a gigantic difference. Before I get into that, I want to say it's good to be here at Germanna School. And by the way, Abigail, if I want to know anything about community colleges in Virginia, I go to my wife. She teaches full-time and has for the last 9 years. She's in the classroom now at community college in Northern Virginia Community College. And she says, you know, the single best-kept secret in America is community colleges. And it really is. They are so flexible, they can do so much. And if I had more time, which I don't, for all of you, I'd go into what we're going to try to do to increase the flexibility and the funding of community colleges for people. But it's great to be here with Abigail, with Congresswoman Spanberger. In every chapter of her career, in every chapter, she's always been about one thing: service. also want to thank Mark Warner and Tim Kaine, your senators here, good friends, and worked closely with me on so many things when I was a senator and now as president and when I was vice president. But they needed to be in Washington today because there's votes in the Senate. I also want to thank Secretary of Health and Human Services, Javier Becerra, for two things. One, for answering my call and asking him to come and be the secretary. I was worried he wouldn't. And how much he's helped us make so much progress in getting people vaccinated, getting health insurance, and making it more affordable health care. Look, health care is part of Abigail, Congresswoman, your Congresswoman's background. Back in 2017, she saw her representatives in Congress vote to repeal the Affordable Care Act. That was one of more than 100 Republican efforts. There were 100 Republican efforts since we passed it in our last administration to repeal the Affordable Care Act. But she knew that that was the exact opposite of what Central Virginia badly needed. You needed then and you need now more access to quality health care that is more affordable. So when I became President of the United States, that's what we did. We passed the American Rescue Plan, which made quality coverage through the Affordable Care Act more affordable than ever before, with families saving on average, who signed up, family on average $2,400 a year in their annual premiums. Compared to last year, the average monthly premium for Virginians has gone down more than 25%. Over 5 million people have gained coverage through the ACA since I became president. And as was mentioned by Javier, over 300,000 Virginians have signed up for health insurance during the open enrollment period here in Virginia. And we want to go further. Lowering prescription drug prices, get a cap on the amount people pay on Medicare, pay for prescription drugs, and to bring more clarity and fewer surprises when you get your bills if you've been hospitalized. So let me say a few words about each of these things now. With regard to prescription drugs, in America, we pay the highest prescription drug prices of any nation, developed nation in the world, the highest of any. And it's about 2 to 3 times higher than what other countries pay. Let me give you one example. An anti-cancer drug to treat leukemia and lymphoma costs $14,000 a month in the United States. The same exact drug, made by the same exact pharmaceutical company, is sold in France, and it's $6,000 a month. $6,000 in France. Same exact drug, same exact manufacturer, same exact amounts. Not 14, but 6.